CEN Test Prep Examples. Question 1. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. Constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 2. A patient leaving against medical advice, AMA, must be informed of. Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 3. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A. Pain medication. Option B. Intravenous fluids only. Option C. Immediate endotracheal intubation. Option D. Neurological reassessment in 15 minutes. The correct answer is option C. Immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 4. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects. Option A. Open-angle glaucoma. Option B. Acute angle closure glaucoma. Option C. Conjunctivitis. Option D. Uveitis. The correct answer is option B. Acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 5. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A. Pulmonary fibrosis. Option B. Right ventricular failure. Option C. Left ventricular hypertrophy. Option D. atelectasis. The correct answer is option B. Right ventricular failure. A massive pulmonary embolism increases pulmonary vascular resistance, which can cause acute right ventricular strain and failure, acute cor pulmonale, due to the increased afterload on the right ventricle. Question 6. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. Synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. Transcutaneous pacing. The correct answer is option C. Immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 7. Priapism is a urological emergency characterized by. Option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. Scrotal edema. The correct answer is option A. Painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 8. The most common cause of airway obstruction in an unconscious patient is. Option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention. Question 9. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A, diltiazem, Option B, verapamil, Option C, metoprolol, Option D, digoxin. The correct answer is Option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 10. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, left anterior descending artery. Option B, left circumflex artery. Option C, right coronary artery. Option D, left main coronary artery. The correct answer is Option C, right coronary artery. ST elevation in leads 2, 3, and AVF indicates an inferior wall myocardial infarction. The right coronary artery, RCA, typically supplies the inferior wall of the left ventricle in the majority of patients. Question 11. CEN Steichen-Blakemore tube placement is used as a temporizing measure for bleeding from Option A, peptic ulcer, Option B, esophageal varices, Option C, diverticulosis, Option D, aortoenteric fistula. The correct answer is Option B, esophageal varices. A CEN Steichen-Blakemore tube is a balloon tamponade device used to apply direct pressure to bleeding esophageal or gastric varices when other measures fail. It is a temporizing measure until definitive treatment. Question 12. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, US citizens only. Option D, patients with urgent conditions only. The correct answer is Option B, any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 13. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is Option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 14. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is Option B, hypoperfusion and anaerobic metabolism. An elevated serum lactate, 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism, which is a key indicator of severe sepsis and septic shock. Question 15. The emergency nurse suspects acute epiglottitis in a patient presenting with Option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is Option A, inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, from inability to swallow, and the tripod position, leaning forward on hands. This is a life-threatening airway emergency. Question 16. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. In the early, compensatory stage of shock, the body attempts to maintain cardiac output and perfusion. Tachycardia and peripheral vasoconstriction are key early compensatory mechanisms. Question 17. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius, option B, pelvis and long bones, option C, clavicle, option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 18. A patient with a traumatic brain injury exhibits deteriorate posturing. This indicates option A, damage above the midbrain, option B, damage at or below the midbrain /brainstem, option C, damage to the cerebral cortex, option D, a positive outcome. The correct answer is option B, damage at or below the midbrain /brainstem. Deteriorate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 19. A Cole's fracture involves the option A, proximal humerus, option B, distal radius, option C, femoral neck, option D, tibial plateau. The correct answer is option B, distal radius. A Cole's fracture is a fracture of the distal radius with dorsal angulation, usually from a fall onto an outstretched hand, foosh. Question 20. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray, option B, needle decompression at the right second intercostal space, option C, administer albuterol nebulizer, option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 21. Which finding on end-tidal CO2, ECHO2, monitoring indicates successful endotracheal intubation? Option A, ECHO2 of 0 mm Hg. Option B, persistent ECHO2 waveform with each ventilation. Option C, ECHO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ECHO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 22. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Epinephrine is the first line and most critical treatment for anaphylaxis. It provides both alpha, vasoconstriction, and beta, bronchodilation, effects. Administration into the anterolateral thigh is the preferred route. Question 23. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperflexia, clonus, rigidity. Question 24. The priority patient for a trauma team activation based on mechanism of injury is: Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 25. A patient with an acute myocardial infarction develops a new hollow systolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture, a mechanical complication of ME. A VSD murmur is typically heard best at the left sternal border.